Doctor, at what stage do most miscarriages
most of these miscarriages actually occur in the range of between 8 weeks to about 12 weeks.
Those are 2 months. 8 weeks are 2 months?
Yes, 8 weeks, about 2 to 3 months.
Oh, okay.
Yeah, so those are the common ranges of ages.
Okay.
For these pregnancy losses which are repeated, yes, they keep on repeating themselves.
Thank you. Can we, before we go so far, can we look at, are there different types of miscarriages? Are they classified, or it's basically the same?
Yeah, so yes, there are different types, but we were talking about the causes. There's one important cause which I would want us to mention before we go there, because it accounts for about 60% of the recurrent miscarriages. And we must mention that is the abnormality of the genes.
From the mother, from the father?
From abnormality of the genes seen in the baby.
Oh.
Yes. Okay. So during the formation of the baby, you find the baby has abnormal genes. Now these abnormal genes could have been carried either in the sperms or carried in the eggs. But it's also important to know that some of these abnormalities develop when the baby is being formed. So you find the mother is okay, the father is okay, but when the baby is being formed, the genes develop abnormality. Now, it's very important to mention this because at the early stage of pregnancy, the pregnancy must be taken care of. We must live in the right environment, we must feed well, because those are things which contribute, you know. These days we have a lot of scans around, security scans, and mothers traveling all over the world, and you are going through scans all the time. And
I wanted to ask you, what could cause those abnormalities in the cells?
Yes, they could be, most of them are environmental. Most of them are environmental.
We get it within the environment.
Yes, so it's a new concept which is really coming up, following the Human Genome Project, as we know, where they were able to sequence now our genes. They now know fully how many genes we have, what roles these genes play. Now that is where we're going to be trying to prevent diseases, because now we will be able to identify which genes get altered by these scans, so that we're able to either fix them also. So that's where medicine is going. But it's very important not to play around at the early stage of the pregnancy.
Doctor, someone is watching you there and wondering, what kind of scan? Is it the scan in the hospital?
No, oh, sorry. Yes, that's a very good question. The scans, not the ones in the hospital, radiation scans. These are the security scans, sort of, or, you know, we scan.
At the gates?
Yes, at the gates, entrance of hotels. Or, yes, either in the airport. Or it's very important when you know you're pregnant, you've missed your period, you need a cover letter. Wherever you're going, you should present that cover letter to the security person. The security person should be sane enough to know this is a very delicate stage of your life, and you should not go through. Yes.
Thank you.
Yep.
Thank you so much, Doctor. Before we go far, are there some medication that can as well cause recurrent miscarriages in mothers, especially when you are treating infections or malaria? Yeah,
yes, it's possible. There are medications which can cause recurrent miscarriages. Now, these medications, most of them could easily be identified. And so that's why when you go to a health worker, the health worker should be able to tell you that this medicine, please, when you are taking it, you should not get pregnant. Mood stabilizing medications are notorious for this. There are medicines people go and take, they take because they have mood issues, they have anxiety. Some of these medications are not very good for early pregnancy. So you have to discuss with the doctor, and when he tells you, please, during this time, don't get pregnant. Please use a family planning method. He really means it. Yep.
Thank you.